And just to clarify, Marly was before us earlier reading for someone who wasn't able to be here, so I just want to be clear.
Exactly.
She graciously agreed to do that.
Thank you so much. I appreciate that. Again, my name is Marly Silverman. You already know who I am. I'm the founder of Pandora. I really appreciate the opportunity to share with you my personal insurance disability story under ERISA. It was really a nightmare. It all started in 1998, just about 13 months. They took me to find the correct diagnosis of chronic fatigue syndrome and fibromyalgia. It had only taken me 13 months. I was very lucky in that respect. But my ERISA insurance disability story is typical of the sad and tragic stories we often hear from our patient community. It is unfortunate, 12 years later, that I still hear the same heartbreaking stories from CFSAC patients across the U.S. dealing with ERISA disability issues. These stories, as well as mine, I'll touch on the quality of life issues, or lack thereof, that CFSAC patients experience 24/7, 365 days of the year. When I look back at the time in my life, I don't even know how I did it. How did I survive one of the toughest personal battles I have ever faced at a time when I was most vulnerable? I suppose it was sheer determination, resilience, persistence, and should I say luck, in having access to an outstanding physician in Florida, Dr. Nancy Klimas, coupled with the unconditional love of family and close friends who are still great supporters of my personal life. I was a junior officer at a major bank. I traveled all over the world representing that bank in Brazil and Portugal. My professional training taught me that I should be able to trust a insurance disability company with my financial wealth. And I did. I did what I would teach or tell my clients to do so. But I never realized that what I knew professionally was just a theory. In reality, when it came time for me to have that access to a disability insurance, I didn't have it. Anyway, after a failed attempt to return to work, my employer told me I had no choice but to file for long-term disability. They simply could not accommodate the challenge CFSME brings to the work environment. Faced with the inevitable, I began the complex bureaucratic process of filing short and long-term disability insurance paperwork. The process is mind-boggling. It's confusing. It's contradictory and simply unfair to ME/CFS patients. It's very difficult for a sick patient to describe what it is to have, in many instances, what is considered invisible illness. The burden that they place in the sick and disabled employee is mind-boggling. Your treating physician opinion does not count. What it counts is the opinions of their medical reviewers whom have never treated or saw you in person to make the final judgment to decide if you're disabled or not. The regulations of ERISA are excessive and extremely bureaucratic. They are part of an administrative process that uses language or legalese, which is often contradictory and counterproductive to the well-being of the claimant, i.e., the individual like me who is sick and injured. It's tiring. One must exhaust all the steps in that administrative process before one is allowed to file a suit against the employee insurance company. By the time one is actually able to do this, personal savings are gone, and a financial crisis of long-term proportion sets in. What Dr. Nancy Klimas said is correct. You lose your house, you lose your savings, and you ended up being homeless. And I've heard those stories. It is heartbreaking. Statistics show that for CFSME patients, it is almost impossible to financially recoup from such harsh losses, leading to a lifelong substandard quality of life, like Dr. Lenny Jason has explained here. In my case, in order to assist me, I had the counsel of at least 3 very good Florida attorneys who throughout the process read, misinterpreted, or simply missed on the interpretation of the regulations or contents of my employer's ERISA policy, which at that time was administered by Liberty Mutual. First, the policy required me to file for Social Security disability, which I did. When I got it, they took it away from me by saying, now you got to repay me back, because part of the process says once you file for security disability, you have to reimburse us. And shortly after that, you know what they did? They dropped me. They dropped me. They told me I no longer was disabled. Or better yet, they actually told me I never had a disability to begin with. Mind-boggling. Social Security told me, and I agree, I had a disability. So the game this insurance played is deny, deny, deny until the claimant gives up, or as in my case, an attorney misses the appeal deadline due to the convoluted set of rules they provide in the risk employee manual. The policy regulations language were so complicated, and one of our distinguished members of this committee can attest to that no one single attorney in my case could really interpret or state for sure after the fact, when the timeline was actually expired, that what appeal policy requirements were really my case. The end result was that the deadline for appeal was missed, and I never had the opportunity to redress my grievances. This is plain wrong. Meanwhile, the harassment from Liberty Mutual, it was constant. They feel me going to my synagogue. They feel me going to independent evaluations. They would follow me if I was walking on the street. They actually follow someone that looked like me going to work. And it happened to be the woman that was renting my townhouse, because it was a two-story townhouse, and I couldn't no longer live there because I couldn't climb up the stairs. So they followed a woman who was 15 years younger than me, but it was slim, and I suppose beautiful as I am, some level, and long hair, and, well, that was her.
If you
she
could
was
wrap
going to
up,
work.
Marly, please.
Anyway, the bottom line is that it is time for ERISA to be revamped. It's outmoded. And one basic suggestion that I have is that to suggest to ERISA to prevent insurance companies, if they want to deny you your financial benefits, fine, but do not take away your access to medical care, because the new Health Care Act does not kick in until 2014. So meanwhile, people are there without medical insurance, and COBRA is extremely expensive. In my case, it was about $875 a month. I could afford it. I had the financial means, but most of us do not have this. So I do appreciate you listening to my story, and I also wanted to say that what Pat Farrell has been doing as far as the NIH research is actually very interesting. We need to find the ways to require or request the NIH to increase funding for CFS. As one voice, one community, one cause, we can truly make a difference for millions of individuals here in the U.S. and across the globe. Thank you for all that you do.
Thank you, Marly.